अब हम आपसे सुनना चाहते हैं आपके अनुभव के बारे में, आपकी चुनौतियों के बारे में और आपके विचारों के बारे में, जो कि हमारे स्वास्थ्य तंत्र को कैसे बना सकते हैं, जिसमें हम मरीज़ को सबसे आगे रखें। चाहे आप खुद एक मरीज़ हैं या देखभाल करता हैं और स्वास्थ्य सेवा से जुड़े हुए पेशेवर हों या फिर एक जागरूक नागरिक हों, वो स्वास्थ्य सेवा को बेहतर बनाने को देखना चाहते हैं, आपकी आवाज़ हमारे लिए मायने रखती है। ये मंच आपके लिए है, आप खुलकर बोलें ताकि हमारी बदलाव की शुरुआत हो सके। Now, let's start with few ground rules to ensure an engaging and respectful discussion. Please share your name and organization while speaking. Respect all the perspectives. Everyone's experience is valuable. Keep your points concise. We want to give as many as people a chance to speak as possible. Focus on solutions. While challenges are real, let's also discuss the idea to improve the healthcare. Please raise your hands if you have any input. Our volunteers will walk up to you with the mic and you will be given 2 minutes to share your ideas. So let's begin the open session. So I would request, oh, I see a hand. I would request the volunteer to share the mic.
Very good afternoon, good morning. My name is Dinkar Singh and I am representing UPS, United Parcel Services Healthcare Department. One of the point which was while sharing the information, it was raised about the clinical trial. So if you see the rule and regulation of the clinical trial, one part of that trial is silence, and it is assumed that any patient who has to come, who is means contributing to the clinical trial, will have to come to the center for giving the samples. What we faced, because being in logistics, many times what we have seen, that lot of drops is there in the clinical trial while giving the samples and all, because the patient doesn't like to come in far area. If he or she is there, then it is very difficult for them to come to the center for giving that samples. So somewhere the rules and regulations would also support the efficient logistics provider who can take these samples from their home. So because of the law is silence here, it is assumed and it is forced that the patient has to come to the center or the hospital for giving the samples. Thank you.
Good morning, I am Dr. Saloni from AIMS. So I have a comment on the project, the trial thing. So we have been conducting various trials in the AIMS in which the field investigator goes to the field and collects the samples. So a lot of funding is needed. So ICMR and DST, DBT, they are supporting in our trials, but we need more trials, and so that we have the ongoing community trials. A lot of trials are going on, but we need more support in that.
So we also had one patient who spoke about Rh negative pregnancy. So if anyone could share more light on that, that would be great.
So hello everyone, I'm Dr. Aparna. I'm a professor at AIMS Delhi, and she's my patient. She's following. What she hasn't told is that she's currently in her ongoing pregnancy and she's scheduled for intrauterine transfusion today. So thank you, Anam. Aap yahan par aaye aaj. So the thing is that I think this is one problem which has a huge impact on individual life stories. There are women who've lost 8 children, 9 children just because they're not aware of it. And what she has told as IUT is something which is called as intrauterine transfusion, which is giving blood to the baby inside the womb. And that actually makes life possible for a lot of fetuses to see the light of the day. But what is more important is, and what we are missing, is something which is preventable. So this particular condition is absolutely preventable if you give one injection of anti-D in women who are Rh negative. So essentially the prerequisite is that every woman should at least have a blood group. If she is negative, then the husband, if it is positive, then in that condition she requires to be given anti-D injections. at least a postnatal anti-D injection is something which is required. And I think in a countrywide survey, which was undertaken by the various project investigators across the country, only 14% of the women are actually getting the whole coverage. So this is something which is a completely preventable condition. And even if the woman gets affected by an anti-D, it's also about awareness. Now there are fetal therapy centers, AIIMS Delhi being one of the most prolific, but otherwise also various parts of the country have therapy centers where they can be treated. So I think it's just lack of awareness on the part which is leading to so many losses and the misery. And I think this is a great platform, and I got to know about this IPU through this conference. I'm really happy. We have a lot of cases that require patient involvement and awareness. So thank you very much.
Volunteers, please pass the mic to sir.
Good morning, everyone. I only wish to share that, my son suffered from mental illness. And, I've come across many psychiatrists. And when you go, you take the treatment. But they never tell you that you have to take this medicine continuously. Don't stop it. When you give the medicine, patients become better. You feel it is all right, there is no problem. But you don't get such kind of advice from the psychiatrist that, you don't have to stop the medicine without asking me. This is one. Another thing I just want to share that I took him to the IPUC. He suffered from, we came to know that he's suffering from, paranoid schizophrenia. And there, he has been treated well. And of course, and it requires long time. It is not that it will happen you will get well in the 1 year, 6 months, 2 years. So the caregiver has to, or the family has to support and have the patience that, you have to take care. Think that you have to take care all along. You just leave him in between, or you don't have to lose patience. So I only wish to share, and this sharing with the experience that, with my continuous looking after him and taking care, he has come out from that. And he's much better. And now he's employed with a bank, doing well, enjoying his work. Thank you very much.
So please pass the mic, sir.
Good morning. I am Dr. Sanjay Rajpal. I head one Swiss organization basically in type 1 diabetes management. What we have seen that one side as because type 1 still knowledge is still, though we are in Delhi, it's okay, Mumbai, it's okay. But if you go 200 kilometers away from Delhi, still अभी भी लोग कहते हैं कि सर किसी ने करेले का वो बताया है, मेथी का बताया है. That is good. So somehow that is one area where this, as ma'am has just mentioned, that education and continuous education is because we are already becoming capital in every health disorder. तो वो एक एरिया है. एंड सेकेंड, एज एन इंडस्ट्री आई आल्सो फील दैट स्टिल काफ़ी पेशेंट्स को आज भी इंसुलिन लेनी पड़ती है वॉयल एंड सिरिंजेस से, बट स्टिल पेन्स आर अवेलेबल, इंसुलिन पम्प्स आर अवेलेबल. डेफिनेटली कॉस्ट इज अ प्रोहिबिटिव स्टिल. तो एज अ गवर्नमेंट, एज एन यू कैन से अ गुड इनिशिएटिव दैट इंटरनेशनल पेशेंट यूनियन, वी हैव टू बिकम अ कलेक्टिव वॉइस कि सभी लोग मिलके, बिकॉज हमारा लक्ष्य सिर्फ एक ही है, टू मेक द लाइफ ऑफ एंड यूजर मोर हैप्पियर, मोर हेल्थियर. थैंक यू वेरी मच.
Thank you, sir. I think for your first point, we have a detailed session later planned on, so it will be very informative as well. We can have the next opinion, your views from the audience. Please pass the mic. So this one person.
Good morning, everyone. My name is Dr. Sanjoli Seni. I belong to a very remote area from Punjab, which is on the border of Jammu Kashmir, Pakistan, and Himachal Pradesh. And people are not much educated in my area. As diagnosed in a very mature age, I had some partial autistic symptoms. And I have diabetes type 1 with chronic pancreatitis and hyperthyroid too. You name something in medicine, I have it. And with those mental issues, nobody knew I ever had. I was pushed to study. I was pushed to work hard to get through from that area, not to get married. Just all the girls have these lives over there, they get married, have kids, and have a family. That's all girls do over there. I was a very special child. I was gifted. I liked biology and mathematics both. I could never choose. Like, my parents got me into medical school. I was like, no, I want to go for engineering. I went for engineering. I got bored over there because it wasn't challenging for me. It was so easy. I topped the university, never bought books about engineering. And I was the first girl to do the programming within 1 hour and 30 minutes, which could be done only in 3 weeks. So this was my story, and I got diseases all along. But right now, I'm normal. I have all the things under control. I'm doing everything I can. I'm doing the physical work. I'm keeping an eye on my diet and everything, and I'm normal. So we need the patient compliance too. They say doctors are very bad patients. No, we are not. We are very good patients because we know what patients need. And patients also needs to understand that. Medicine should be taken as a food, and food should be taken as a medicine. This is what Hippocrates said. And this is what every doctor and patient should have in mind. I think that is very important because doctors get fed up of patients' behavior, keep asking the questioning, but never acting in their good health. So that is very must. If you are also the patient load needs to reduce day by day if we are getting healthy. Nobody is working on the root cause of all the health problems. Everybody is buying the refined food, eating unhealthy food. Nobody is working on organics. Nobody is working on environment that causes the diseases. Patients need to understand how we should manage the waste, how we can reduce the pollution that would keep them safe. That is what we needed. That was the main thing we needed to learn in COVID in 2020, and nobody did. Everybody is working toward saving the human. See, our existence won't even matter if we won't have a planet to live on. So I'm a doctor by profession, did everything I could, went to a business school too, but now I'm going for the environment. I'm working on that root cause. I want to make such an environment in India that nobody falls sick due to those causes, imbalance of minerals and vitamins in our body. I think these are the things we need to work on too. So everybody go for it, go read about the nutrition, how you can keep your body healthy. You won't need medicines, the piece of stones to work upon. It's man-made. These all are drugs, as we say, and medicines in a layman terms. So we need to keep an eye on this. This can be toxic too because patients keep taking paracetamol without any prescriptions. Paracetamol also have toxicity. It does cause the poisoning too, right? I think all the physicians would agree with me. So patients are going for that. Patients also need to understand that. And we need a training for the doctors for to be more empathetic towards the patients. With the daily routine of the doctors, we lose empathy somewhere in our work, and we need to get it back. So I think hospitals should also have such training programs for the medical profession to keep their humanity alive. So that is all I had to say. Thank you.
Thank you so much, ma'am. I think we can pass the mic to sir in the second row.
Hi, I am Dr. Naren Agarwal. And first of all, Rajendra, this is a very nice, very engaging session. I would like to thank you all for sharing your personal experiences here. One quick comment. In my experience of visiting hospitals throughout the country, what I realize is that the ICUs, they are not designed to keeping the patients in mind. Generally, ICUs in India, there is one big hall and the patients are on different beds, while it is entirely different in the Western world. And surviving an ICU is not easy. It's a mental battle. Every patient goes there every day. Within 3 days, I see majority of the patients, they get disoriented. They don't have the day and light concept. The designing is not as such. The patients are not even told what time of day It is, and they are always dealing with artificial lights and a lot of noise. There are no recommendations or proper guidelines in place where the hospitals could be especially designing the ICUs, keeping the patients and the long-term outcomes in mind. And that is what I wanted to highlight here. Thank you.
Thank you so much, sir. If anyone would like to share their experience or would like to comment on the session, so please, volunteers, please.
Thank you so much. I'm Dr. Mohammed Hashim, the health attaché of Iraqi embassy. Actually, we have many patients from Iraq coming to India for getting the management regarding especially surgical procedure. And we are, during our work, we are facing many problems regarding the interpreter. There is actually no one know this is belonging to the hospital or private or had any ID to be known. This is dealing with our patients. It is belonging to the hospital or it is from outside, and it is honest in his translating the subject between the doctors and between the patients. And actually, this problem discussing with many hospitals, especially in Delhi, but no one answering or getting a solving for this problem. I am facing this conference regarding this subject in order to know actually complaining of these things. The other things, there is no fixed prices of any surgical procedure. It is different from place to place, from hospital to hospital, and there is no guide regarding this subject. We are facing no guide. Some patients is very high prices, the others it is not actually organized, and it needs some efforts from many union dealing with the patients, with the hospitals in order to organize the subject. The other things, sometimes it is actually during my work, I facing some hard dealing with some our patients. Actually, some hospitals experience like a new drugs not approved by the Indian institutes, and the new drugs to try to experience on our patients, and actually we lose some of our patients in some hospitals. We are organized these hospitals. I work in many hospitals in Iraq, and I was a minister of health in some governorate in Iraq. I not hear or see any patients with some diagnosed disease treating like multiple myeloma, and there is a new drugs known in Europe or in America. It is not used in my country until it is approved by the health ministry committee in Iraq in order to use these drugs in this subject, and not some hazard treating with our patients who are coming to India. Actually, I facing my colleague this, and I need the help of you and the conference in order to organize, because we are like the the people of India. We have a long history with them, and we want to continue our dealing with Indian people, with the Indian hospitals, because this is our message in India. Thank you so much.
Thank you so much, sir.
I'd like also to share the same point, one of the most important points that with the hospitals, I want to express first myself. I'm Uday, consular of the Embassy of Iraq. As I headed the mission long time, before joining Dr. Muhammad as a health attaché at the embassy, we met some of the hospitals, received who's in charge with the foreign patients at the embassy. I found that one of the most crucial issues that patients are facing, and also at the same time, embassy, is the illegal translators that, unfortunately, that big hospitals here in India dealing with as illegal. There is nothing legally expresses that this is a legal translator that's working in a legal way with this hospital or that, which causes many problems with the patients. And as we are at the embassy and the health attaché, we are working together. We want and we request the esteemed conference here to starting this point to have a real joint, cooperative, mutual work with the embassy and with the health attaché, that to find a way to specify legally the translators. Now, anybody can just speak English. Some of the translators, even Iraqi translators, they're having a treatment or medical visa from Embassy of India in Baghdad. They came to India just as he has English language and join any hospital. And I don't want to mention names of hospitals. We have lists, frankly, to be sure, and let all the hearing me. We, as an embassy and health attaché, recommended, because of this issue, which causes lots of loss of Iraqi patients, we recommended some of hospitals as blacklisted hospitals, and some of them as highly recommended hospitals. We have lots of patients. And as I was talking with at the beginning of Mr. Gupta, and highly appreciate this invitation about this crucial issue. So we don't want to lose the deal with the Indian hospitals as a main target of the most of Iraqi patients. And Mr. Muhammad has a approximate amount of the monthly patients who are coming to treat in India. So again, we want a good joint, real, mutual cooperation in this field. I'm sorry for talking too much, but thank you so much for this opportunity.
Thank you so much, sir. I think both the dignitaries have put out certain questions, and I hope today you will, at least you will get some answers today. I hope so. Anybody else who would like to share their experience? Yes, so please.
Good morning. I'm Dr. Amitabh Verma. I'm a neurologist. So I wanted to address one specific first question which was raised by Mr. Vijay Khanjia. That is regarding Huntington's disease. We have a Huntington's Disease Society of India, which was formed in 2018 in Imans. I started it actually when I was a management board member there, and took place in 2018, formulated formally, which looks after these trials also, patients' addresses. If you're aware of that, write to them. They may be able to communicate, okay? Huntington's Disease Society of India, Bangalore, Nimans. Thank you.
नमस्कार, मैं डॉक्टर राजेंद्र प्रताप गुप्ता जी से रिक्वेस्ट करूँगा कि सभी बीमारियों के बारे में आज चर्चा हो रही है। ऑटिज़म के बारे में भी भविष्य में पूरी चर्चा होनी चाहिए, क्योंकि जिन परिवारों में ये बच्चे हैं वो बच्चे परिवार और बच्चे बड़ी दिक्कत में रहते हैं, और हमारे समाज का अंग नहीं बन पाते हैं। जहाँ तक मुझे जानकारी है, मेडिकल साइंस में इसके ऊपर अभी कोई भी मेडिसिन डेवलप नहीं हो पाई है, परंतु हम अवेयरनेस के द्वारा परिवारों की समस्याएं कुछ दूर कर सकते हैं। धन्यवाद।
Sir, on this autism, we are doing a big study on behavioral disorders, and we will reach out to you all also. And this is a study about what we can do to address that, mostly for children. And it's underway. It's a long-term study that we are doing. We'll address this. Thank you.
Sir, I think Vijay sir has a point. So
Right, sir. I actually know about this organization, that is the Huntington Disease Society of India. The problem is that, like in the Western nations, almost every country has multiple hospitals that are specifically dedicated to the Huntington disease. I mean, not only Huntington disease, like there are many rare disorders for which there are specialized centers and specialized hospitals. Only United States has around 35 to 40 hospitals that are specifically for Huntington disease. In our country, there is no such system wherein there are specific centers in general or specific hospitals for specific diseases. Like for Parkinson's also, or like dementia is coming up as a very common problem in the coming generation. So like for dementia, there are specific centers, specific research centers and specific hospitals all across in the developed countries. So the institutional mechanism for a medicine that is in a clinical trial to reach the remotest corners of the country, that mechanism is not present at the moment. So wherever the clinical trials are going on, there is a proper mechanism that the healthcare system reaches the remotest of the population. There is a like Huntington disease center in a city with only 1 lakh population in UK, to ensure that the care reaches the remotest of the population. Not only the care, there is a mechanism that the medicine and trial also reaches the remotest of the population. So if we are sitting in a city in India wherein like there is no access to the specific Huntington disease center, or there is no access to a specific medicine in a clinical trial, then a person has to run to a faraway place. And what happened with me was, like, I have been running to hospitals all across, like in UK or in United States, and there when I went there, like the doctors passed the eligibility criteria for the patient to get the medicine, but due to some reasons I was unable to get the medicine from the hospital. So availability of medicine is not the only concern. There are social issues, there are geopolitical issues. The science can solve the medical problem of researching on a disease and getting the medicine, but the science cannot solve the geopolitical or the social issues to ensure that the medicine developed in a European nation reaches the remotest of the population in the developing nations. So I mean, these are some of the issues that need a brainstorming still. I mean, these are the issues that are at a very nascent stages in most of the countries in the world. So I mean, and not only for the rare diseases, for the well-established diseases also, the problems of geopolitical concerns and the social concerns occur. And like we are suffering from a rare disorder, and we can imagine like how difficult the situation for a patient becomes when a patient is suffering from such a dreaded rare disorder. Right.
We'll be happy to take another opinion from the group. Oh, so we have a hand.
Yes. Good morning, everyone. Myself, Dr. Pradeep Reddy. I am a public health professional. So currently, this International Patient Union, from the public health perspective, if I think, because we are currently discussing on the patients who are having the disease and their experiences. For example, we think it very retrospectively because when we get a disease, then we think about the preventive measures or what are the treatment plans available and what are the facilities available. But we also need to keep in mind or understand one thing, that when, as a public health professional, I say that there are many initiatives that government also has initiated when it comes to different scale of diseases or conditions. So in such a way that it also given the awareness also from the government side and also from the private side to the patients about the diseases. For example, today one of them, they have shared the experience regarding the NCDs. So regarding the non-communicable diseases, there are many awareness programs being undertaken, not only at the remote level or the grassroots level, but also at the highest levels also. So what my point here is, so not only we just say that systems should be in place or facilities should be in such a way, at the same point of time, from the patient's point of view and also from the public point of view, there should be health-seeking behavior should also be improved. Like health knowledge should also be improved. That's why when there was one of the question in the questionnaire given by the organizing team, that why the patients should also be given the opportunity or why they cannot be come to a policy level, because there is first of all there is lack of knowledge. So I opted for that because especially, yes, we can observe that being a public health professional. Thank you. This is a point I wanted to highlight.
Thank you, sir. We have a point from ma'am.
Yeah, good morning, everyone. So first of all, thank you, Mr. Gupta, for this forum. I think it's a very interesting perspective. I represent Manjanda's Endoscopic Center. We are a gynecological center of excellence run by Dr. Rahul Manjanda. We've been doing many awareness camps, health camps related to our subject, where we do free pap smear tests, free breast mammogram tests. We've been doing these for the last 20 odd years, and we have seen the incidence of the findings, whether it is breast cancer, whether it is cervical cancer, really increasing in times to come. Since there are many people sitting here who maybe have a role to play in policy, I would strongly urge that the cervical cancer vaccination should be put as a part of the immunization program, which it currently isn't. It has up to a 99% protection which can be given. There are 2 doses when the child is young. As you grow older, there are three doses which need to be taken. So given the kind of work that we do and what we see, we definitely feel this should be put on the immunization program. Thank you.
Thank you so much, ma'am. I think we have a hand raise.
आप सभी को मेरा नमस्ते। मेरा नाम अजय सिंह है। मैं बिहार का रहने वाला हूँ। यहीं दिल्ली में प्राइवेट काम करता हूँ। मेरी 2 बेटी है, दोनों थैलेसीमिया पेशेंट है। पहला बच्चा हुआ तो 6 महीने बाद पता चला था उनको थैलेसीमिया है। फिर अगले बच्चे हुआ तो उसमें डॉक्टर ने हमें बताया नहीं कि अगला बच्चा की जांच करा के करना है। और मैं हर 21 दिन पे ब्लड चढ़ाता हूँ दोनों बच्चों को यहाँ बसई दारापुर में। इसलिए मैं आप सबसे यह अनुग्रह करता हूँ कि आप लोग इस पर ज़्यादा ध्यान दें। मैं ग्रुप में भी जुड़ा हूँ जहाँ 100 परिवार 200 परिवार के बच्चे इस थैलेसीमिया पीड़ित है।
Thank you so much, sir. We have in the back.
So, good morning, everybody. My name is Yuvraj Chopra, and I am representing BASF, which is a global company into crop protection products. So, I wanted to draw the attention of this August gathering to the fact that many times accidental exposure to pesticides can lead to certain rare diseases. And in order to prevent those, there is a need to have a national MRL fixation process. So currently we do not have MRLs specified nationally for all the pesticides which are used across the country. The last notification came sometime around 2018, and since last say around now 7 years, many new pesticides have been approved by the FSSAI and the Central Insecticide Board and Registration Committee. So we request policymakers to nudge the government to come up with a national MRL notification which should cover all the existing pesticides, old as well as new. Thank you.
Thank you so much, sir. I think we had a hand raised at the
So,
back. I think ma'am is already speaking something. Please.
So I think I would like to respond to the gentleman who has 2 children with thalassemia. I think there are 2 points that I'd like to make here. One is primary prevention. जैसा कि इनके दोनों बच्चों को होने के बाद इनको पता चला कि ये हो सकता है, तो प्राइमरी प्रिवेंशन में एंटीनेटल केयर में एक सिंपल टेस्ट होता है HPLC का, जो कि एक पॉलिसी वाइज इम्प्लीमेंटेशन इंडिया में बहुत ज़रूरी है. दैट कैन डिटेक्ट, एक बच्चा होने से पहले ही हम डिटेक्ट करते हैं. एम्स में रूटीनली वी टेस्ट फॉर प्रीनेटल डायग्नोसिस. जब बच्चा पेट में है तो उसको टेस्ट करके देख सकते हैं कि थैलेसीमिया उस बच्चे को है कि नहीं. ये सर्विसेज एम्स और एम्स जैसे बहुत सारे आजकल कॉलेजेस हैं, प्लेसेस हैं जहाँ पे ये टेस्ट प्रोवाइड किया जा सकता है. तो प्राइमरी प्रिवेंशन के लिए सारी महिलाओं को अगर हम पॉलिसी वाइड एक बोलें कि एक सिंपल टेस्ट है HPLC, उसको करा सकें ताकि पता चले कि मदर को थैलेसीमिया है. सेकेंडरी प्रिवेंशन के लिए जब एक बच्चा थैलेसीमिक हो चुका है तो जब अगला बच्चा पेट में है तो हम पेट में ही उसकी जानकारी कर सकते हैं कि उस बच्चे को थैलेसीमिया है कि नहीं. तो ये दोनों चीज़ें जो हैं वो नेशन वाइड, मतलब एक बहुत इन्फॉर्मेशन है जिसको डिसेमिनेट होने की बहुत ज़्यादा आवश्यकता है. ये कम्प्लीटली इसको रोका जा सकता है और प्रिवेंट करा जा सकता है.
Thank you, ma'am. I think we have a hand raised at the back.
Good morning, everyone. I'm Rashi. I'm actually employed at AIIMS Delhi, currently at National Drug Dependence Treatment Center. But right now I'm pursuing Masters in Nursing from IBAS Hospital. And I would like to share my opinion as a caregiver to my mother. She is suffering from psychiatric disorders since last 14 years. So when she started having symptoms, I was a child back then and I was not having any background of medical knowledge. So at that time she started getting unconscious suddenly, and we took her to some reputed private hospitals, and she was treated for epilepsy, seizures, and she was getting treatment under neuro specialty. For 2 years we were giving her epileptic medications, but when her condition deteriorated and she started having episodes of unconsciousness and passing motion and urine in bed, so at that time we took her to AIIMS Hospital, and around 8-9 years she was in AIIMS, and many studies happened on her, and she was taken as a case study, and we were called for meetings, and then she was diagnosed with dissociative conversion disorder, which she was treated for next few years, and later on she developed dependence for benzodiazepines, which we were not informed initially. She was given benzodiazepines for a very long time. So my first issue is that diagnostic aspect of psychiatric disorders in private hospitals, which is hugely mismanaged. So there has to be some strict guidelines for that for private hospitals. But thankfully my mother was diagnosed at AIIMS, which I am very grateful for. And after that, from the medication point of view, my mother got addicted to benzodiazepine. So next battle started for us was de-addiction. And currently I'm also appointed at de-addiction facility of AIIMS Delhi. So I would like to share light on that point also, that some strict policies should also be in place for de-addiction point of view, because many policy makers are here. Thank you so much.
Thank you. Can we share the mic with sir? Oh, sure.
Good morning, everyone. Myself, Himanshu Sharma from DDK Healthcare. So basically, we are supplying Army right now, Pan India, and we are dealing in all the critical care, anti-cancer, HIV, and hepatitis medicines. And we are exporting also in 20 plus countries. So right now, the challenge that we are facing is we have been supplying to a lot of African countries and Middle East areas, and we are giving services, medicines to door-to-door services to the patients. And there are a lot of R&D is also going on new molecules. But the challenge is that there have been a lot of restriction and there are certain licenses that take certain amount of time, which just gives us a blockage and we are not able to get that medicines to the patients. And right now we are making sure that since critical care is a major concern, and there are a lot of anti-cancer molecules that a lot of Indian manufacturers are making in, and the process is a little slow just because of the documentations. So if we could just speed up or get a solution out of this, so it would be great for the patients, since they have very small amount of time once they detect that they are suffering from cancer or any critical care. That's it. Thank you.
Thank you so much, sir. I think we have ma'am at the back too.
Hello everyone, myself Dr. Manjeet Rathi. First of all, I thank you Dr. Gupta for creating such a nice platform. Actually, I have मैंने पहली बार ही ऐसा प्लेटफॉर्म देखा है जिसमें पेशेंट्स भी बोल रहे हैं, और मैं अपना एक्सपीरियंस ये शेयर करना चाहती हूँ कि एज ए पेशेंट I was diagnosed with leiomyosarcoma of uterus 3 years back. It's a very rare disease, and my experience with hospital was very bad. In ICU, as doctor also had said, कि ICU में भी बहुत अच्छी केयर अभी हमें और ज़रूरत है ICU को इम्प्रूव करने की, क्योंकि मेरी एक बहुत बड़ी सर्जरी हुई थी यूट्रस की और बहुत यंग एज पे हुई, तो उसमें ICU में उतनी केयर नहीं हुई जितनी होनी चाहिए थी. मेरे हस्बैंड भी हरियाणा सिविल मेडिकल सर्विसेज में हैं, तो हम दोनों ही मेडिकोज होने के बाद भी मुझे उतनी केयर नहीं मिली. तो मैं ये एक रिक्वेस्ट करना चाहती हूँ कि एज ए डॉक्टर जब हम पेशेंट की तरह किसी भी हॉस्पिटल में विजिट करते हैं तो डॉक्टर्स तो हमेशा सपोर्ट करते हैं कि हाँ ठीक है आप डॉक्टर्स हैं. आई ऑलवेज गॉट वेरी पॉजिटिव रिस्पॉन्स फ्रॉम एवरी डॉक्टर्स, बट स्टाफ जो स्टाफ होता है हॉस्पिटल का, चाहे वो प्राइवेट हॉस्पिटल का हो या गवर्नमेंट हॉस्पिटल का हो, वो नहीं ट्रीट करते. वो कहते हैं कि आप हमारे हॉस्पिटल में थोड़ी डॉक्टर हो. तो दिस शुड नॉट बी ट्रीटेड लाइक दैट नो, कि हम डॉक्टर्स तो हम हैं, हमने इतनी स्ट्रगल किया है डॉक्टर तक करने का, अपनी क्लिनिक मैनेज करने है. डिप्टी मेडिकल सुपरिटेंडेंट थी मैं एल्टिस हॉस्पिटल की. मैं कह रही हूँ स्टाफ को, बट दे आर नॉट ट्रीटिंग. तो इसके लिए भी होना चाहिए. दूसरा, एक इमरजेंसी केयर के लिए भी मैं कहूँगी, बहुत अच्छे हॉस्पिटल से मैंने अपना ट्रीटमेंट कराया था, but that time I got after surgery I got intestinal obstruction few days back after surgery, and I rushed to that emergency. Very good hospital, but I don't want to name that hospital because that I have to wait for 4 hours in emergency. My husband said that she got emergency, we need an emergency ultrasound, but nowhere what they're there to treat. They are saying that आपकी जो डॉक्टर हैं जिन्होंने सर्जरी की थी, she is in ICU, she is in OT, तो वो जब आएंगी तब अल्ट्रासाउंड होगा. तो ये नहीं होना चाहिए. तो बस मेरी यही रिक्वेस्ट है कि एज ए डॉक्टर्स वी शुड गेट सम प्रेफरेंस, और वैसे तो सब ठीक है. और आई ऑल्सो थैंक्स टू डॉक्टर गुप्ता अगेन and all of you. Thank you.
Thank you so much. I think with this we will be closing the open session. The conversation can be carried forward in the break time. I mean, we all are here. Definitely the conversation would be long.